Hello, doctor.
Hello, good morning Mrs. Nair. I am Dr. Krishnan and this is Dr. Roy. She's here to observe.
Good morning.
So, what brings you here today?
Doctor, I have been having this persistent cough for the past 1 month now and I am very worried. I tried a lot of home remedies, but nothing seems to help. I want to be sure this is not COVID.
I see. It's a good thing for you to come and get it checked. Let me ask you a few questions and then understand your symptoms. So, are the coughs usually dry or do you experience sputum discharge?
Mostly it has been dry cough.
What about fever? Have you had any fever? Do you feel any tiredness or body pain?
No fever. I check my temperature every day since the COVID situation became serious and have not had fever. But I have been feeling tired.
Have you or anyone in your family been abroad recently?
No, my children live abroad and haven't visited home, and in my house there is no one else but me.
Oh, so you take care of things on your own? That must be a lot of work.
Yes, but I manage. I do have a house help, but since this COVID situation started I asked her not to come, just to maintain the social distancing.
I see. And have you had any difficulty breathing along with the cough?
I am not sure, but I don't think so.
Can you take a few deep breaths for me now? Let me examine you. Dr. Roy, can you please close the curtain? Your respiratory system is absolutely normal, which is great. This is just an allergic dry cough, probably because of seasonal change. Nothing serious to worry about. I will prescribe you some medicine for it and you should be fine.
Are you sure it is only that? The cough has been there for a long time and I read in the news that people of my age are particularly vulnerable to COVID. Just as a precaution, I would like to do the COVID-19 test. This has been very worrying for me, and knowing for sure whether I have it or not can really help.
I completely understand your concern and you are absolutely right about the fact that you fall under a vulnerable age category. But after conducting the examination, your respiratory functions are absolutely normal. A COVID test would be quite unnecessary.
But I could have mild symptoms of COVID? Isn't it better to do a test? I am just worried that even though this is nothing now, it might get worse later. I get cold very easily and I am afraid that if I ignore it, it will get a lot worse.
Your worry is very much valid, especially because the symptoms are so similar to a common cold. Dry cough is indeed an important symptom, but so are the others. And since you have no fever, or sputum discharge or breathing difficulties, there is no cause for concern. I understand how nerve-wracking this situation is, with no clarity over symptoms and cure. But you have done the most responsible thing you can by practicing all the precautionary measures, and when you were worried about your health, you came to get it checked.
That's true.
Your medical history also shows that you don't have any pre-existing conditions like hypertension or blood sugar. You have been really careful with your health till now. That's quite impressive.
Thank you. So I shouldn't be very worried then?
Don't worry. Right now there are no indications for any additional tests needed to be done. If your cough continues even after you have finished your medicinal dosage, then come back for another checkup. Dr. Roy will update your charts and transfer your prescription to the pharmacy.
Yes, doctor.
Just take it easy for a few days, Mrs. Nair. Continue to take the precautionary measures you have been taking and take your medicines twice, after lunch and dinner respectively. You can collect the medicines at the pharmacy. Also, I would like you to verify articles or news before believing in them. Even wrong information is like a poison and can be dangerous to health.
Okay. Thank you, doctor.
Take care. Have a nice day.
She's the third patient this morning who has come in with concerns about COVID but actually not being sick with it.
A very good example of the worried well. Get used to this. You will encounter many such people during your own consultations.
It does make it really difficult to concentrate on those who really need the help. But then again, a global pandemic situation does lead to massive anxiety in people.
Patients can't be blamed for exercising caution and wanting to be safe. That's what we demand of them.
That's true.
So Dr. Roy, now that you would be seeing patients on your own as well, what would you do if Mrs. Nair comes back again with the same complaint, again demanding a test?
I will first listen to her concerns and then proceed accordingly. If her symptoms warrant testing, then I will recommend it, and if not, then I will explain to her why a test is not needed. And if the patient is too anxious and unable to go about her day properly, then I will refer her to a psychiatrist.
Good job. Always keep an eye out for their mental health as well. Now, Send in the next patient.
Prevention is better than cure, and during times of crisis, the mark of the responsible is the exercise of caution. However, remember that your exercise of caution should not be at the cost of someone else's right to treatment. Together, let's be responsible. Stay aware. Exercise caution. Prevent commotion.